Right, so hi, I'm Tony, and I was a dentist, and this is all about how think I can help with care homes because this publication came out last year, and if you're in a care home, you know this that lots of people die early from aspirational pneumonias related to poor oral health. So this was me a long time ago with my dad, and that's the story really, is because unfortunately my dad got ill, like many of us will, and this was 2016. So he had a great life up till then. But yeah, obviously things went awry, and I couldn't help my dad. So I decided, well, I'll see if I can. Lots of my patients were carers, and that was interesting because I learnt a fair bit more from the carers than I did from the profession. And I made a website to help the carers, and it's changed quite a lot because I have made quite a few videos. But anyway, but one of the things that I did do was this: is that for my patients, I thought, because I was always keen on prevention, I wanted to explain the BPE, which is basically the screening mechanism that we use. And it's a good way to market, it's word of mouth. And and then I made tried to go on social media. I have been completely unsuccessful, but if you go onto that, it's also called Teeth for Life, I think. This guy talks about how he was upset because the treatment I did failed after 30 years. I'd only guaranteed it for 10, and the thing that I told him wouldn't last is still there after 30 years. There's an awful lot more that we can do, and this was it. That's what I'm trying to do. So, this is what I did around that time after I sold my business. I decided to make an app because I thought, well, that's what you do, and that's it, is how do you promote prevention? And so it's all about getting you to engage, to give you a score, um, and getting the green. Yeah, so clearly I've done this wrong. Anyway, that's what it is. So, and then come March 2020, I was on with my mate's 60th birthday, and anyway, basically I got stuck, and I didn't come back. I got repatriated, then come back to work like this, and I'd really enjoyed dentistry, but the values that I had were not the same as the person I'd sold my business to, and so I left, and I thought I'll just try and do what I always said I'd try and do. And there are things that we can do that are different. So we can go around schools and we can go around care homes, and using modern technology we can do these asynchronous checkups. So it's all there. And there's the same thing, the products out there now that for some reason aren't being used. They've been used in Japan for over 70 years, and it treats the decay. It doesn't have to remove and put a filling in. You just got to get it at the right time. And this, we had teledentistry during COVID. It's gone very quiet on teledentistry. It's green, prevention. It's green, So I'm going to the States to learn more about that. And this one, 3D printing. I remember when it first came out, and it was rubbish. Well, it's not rubbish now. So these are the sites that I have now that I've sort of created in the last 3 or 4 years. So there's the one that I made originally is I've made it better for the mobile, and then we haven't got a dental health service, but I think we can make one as a profession and as the public if we all collaborate. And yeah, I've made one for how you can do dentures through 3D printing, but there's so much more. If you have a look, you can see what we will be able to do, and I think that might be it. Oh no, it's not. Yeah, I really ought to learn how to do this properly. But anyway, that's what I'm trying to do. And so this is for carers. This is to help you. So it's an intro. So have a look at the next section because, yeah, it's how you can look after yourself before you start looking after the people in your care.